Pectoral muscle and pectoral tendon tears are not common injuries among the general population, but they are common among athletes and weightlifters. In this video, I'll explain how these injuries occur, what to look for to suggest you might have an injury that needs surgery, and how these injuries are treated. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Pectoral muscle and tendon injuries are injuries of your pec, the big chest muscle across your front of your chest. Basically, it's a muscle that becomes a tendon that attaches to your upper arm. Typically, it occurs in a sport like football or in something like weightlifting where you're bench pressing. So in football, it often occurs where you get your arm, the athlete gets his arm pulled back behind him, ripping that muscle or tendon. In bench pressing and weightlifting, typically it's the eccentric, it's the downward motion of a bench press, but again, it's loss of control of the weight or something like that puts a sudden force on that muscle or tendon. Now, it's tricky because typically pectoral muscle injuries don't usually need surgery. Muscle tends to heal pretty well on its own, whereas tendon injuries where the tendon's pulled off a bone usually does need surgery, and in between are the musculotendinous junction where the tendon becomes, or the muscle becomes tendon. Those a lot of times do need surgery, but sometimes don't, and it can be tricky. There's not a super easy way just on your own to know, but if the bruising is here in your muscle, maybe that is going to turn out okay. Whereas if it's more bruising in your upper arm, that's usually a sign the tendon has pulled off of bone and you might need surgery. Something that a physical exam by the orthopedic surgeon can help, but a lot of times an MRI of the shoulder and upper arm can really show you if the tendon's torn. If it is surgery, it's typically a small open incision and the surgeon reattaches it with stitches and anchors to reattach it to bone. Then it's all about getting that to heal, holding the arm in a certain position for a few weeks to get that tendon repair to start healing, and then working to get motion back. And then after that, working to get strength back, and then working back into your ability to play sports or lift weights, whatever it is. But it's a long process. It's an outpatient surgery, probably takes less than an hour, but it's a very, very long recovery, many, many months. You can have good outcomes, but it can be really tricky. If it doesn't need surgery, it's just typically time and work with a physical therapy. Still can take a while, but not as long as the tendon injuries that end up needing surgery. Now, I'd love to hear your experience with your shoulder injury. Leave those in the comments below this video. Just understand, I can't give you medical advice, but I will try to answer your question in a future video on this channel. Also, make sure to subscribe to this channel. Click the bell to be notified when I release a new video or when I start another live stream like my Ask Dr. Geier live shows. And if you have knee, hip, shoulder, or some other joint pain and you want to get significantly better in the next 30 days without cortisone shots, physical therapy, or surgery, learn more about working with me in the description below this video. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.